According to the OTPF4, occupational therapy services are provided for habilitation, rehabilitation, and promotion of health and wellness for clients with disability and non-disability related needs. The quote you see above further explains the true focus of OT. Occupational therapy is a unique process which includes evaluation, intervention, and outcomes that focus on client factors, contexts, performance patterns, performance skills, and occupations. Activity analysis is a process which breaks down an activity into small units of behavior. A clinician performing an activity analysis will first identify the activity, determine its importance to the client, and identify the steps required. Then, objects, properties, space demands, and social demands are analyzed and considered. Finally, the clinician will determine the required body functions and structures, as well as the performance skills to successfully complete the activity. Today, we will be breaking down the steps of applying false eyelashes. This activity can be done by anyone who is interested in or who values self-care practices. Applying false lashes is a choice that an individual can add to their self-care routine if they wish to do so. Applying false lashes is considered an activity of daily living, or ADL, because it constitutes as a process to take care of the body. For some, this activity is more meaningful than others. The objects and properties for applying false eyelashes have been analyzed. Tools needed include tweezers and a mirror. Supplies required are eyelash adhesive glue and Flutterhabit faux lashes.
Here you see the mirror, the tweezers, the lash adhesive glue, and the Flutterhabit faux lashes.
Space demands are important to successfully applying false eyelashes. The participant will need a clear counter to set out items, a mirror to see, and ample lighting. Applying false eyelashes is an individual choice and activity. Cultural contexts have different standards of beauty, and some may be more accepting than others of the use of false eyelashes. However, there are no specific social demands required by this specific activity. Body functions required include higher level cognition, sustained attention to complete the task, working memory to complete the repeated steps in the activity, perception and discrimination of sensations to know when a lash has been successfully placed, control of thought, sequencing of complex movements, consciousness, orientation, energy and drive to complete the application, visual acuity and stability during application, vestibular balance when standing, awareness of body and space, joint mobility, muscle tone, and sustained muscle contraction when holding tweezers. Listed here are the body structures required to apply false eyelashes. Identifying the body structures needed allows for clinicians to predict what areas of the activity their clients may struggle with based on their current condition. Take a moment to look through these structures.
Remove the plastic card of faux lashes from the box. Remove the outermost lash segment for the right eye with the pointer finger and thumb. Hold the lash segment with your non-dominant hand. With dominant hand, pull off additional adhesive. Transfer lash segment from fingers to tweezers and hold in non-dominant hand. twist open the lash adhesive cap. Squeeze a small amount of lash adhesive with dominant hand onto the lash segment. Transfer tweezers to dominant hand. Lift eyelid with non-dominant hand. Place the first lash segment in the outermost corner under the lash line. Push up on the lash segment with the back side of the tweezers. Repeat steps 2 through 10 to complete the right eye, and continue on to repeat steps 2 through 10 to complete the left eye. Wait 2 minutes for lashes to dry. With the pad of the index finger, push up on the lash segments to complete their positioning.